Right. My patient is a 75-year-old man who just had a left transtibial amputation, and his past medical history includes peripheral vascular disease, high blood pressure, diabetes, chronic kidney disease, stroke, as well as decreased vision, anorexia, GERD, anemia, and depression. So precautions for our patient include those precautions for the transtibial amputation. So we are watching the incision and making sure that there's no infection with that. And we are also trying to prevent and educating the patient about preventing knee and hip flexion contractures. We're also, as far as his diabetes, monitoring his blood glucose levels and doing skin checks and teaching him how to do skin checks on places that he might get a pressure ulcer or has a wound maybe in his foot that might get infected. So the patient was modified independent for bed mobility and transfers before his surgery, and now he is max assist for everything. So the goals for the patient include increasing his bilateral lower leg strength from a 3- to a 3+, and this will help with his other two goals to perform bed mobility with modified independence and also performing functional transfers with minimal assistance. Okay. Hello. My name is Kathy, and I'm a student physical therapist assistant. Can you tell me your full name and date of birth, please?
My name is Jack Sparrow, and I was born December 5th, 1937.
Okay. So how are you feeling today?
I'm pretty good when I'm not moving.
Okay. And then when you are moving your leg, are you in pain?
I am.
And on a scale of 1 to 10, so 10 being the worst pain ever, where is your pain when you're moving?
I'm at about an 8.
Okay. So we're going to do some exercises today, but we're also going to address. We're going to use some techniques that will help to reduce that number, and you can use these techniques as well in between our sessions.
Okay.
But first, what we want to do is check your blood pressure. Sound like a plan?
Mm-hmm.
Okay. All right. Cut. Go. All right, so what we want to do right now is check your blood pressure. You okay with that?
Mm-hmm.
Okay. Just relax your arm. So you're about a 135/85. Okay. All right. So now what we're going to do is put you into a position so that we can do some measurements for your hip extension. Remember, we talked about how you don't want to develop a shortening of the muscles in your hip. So we want to make sure that that's not happening, okay? So we're going to cut. At this point, I'm going to get these out of your way. Shoot this down. And I have to get my gummy. Okay, so here's what I'm going to stomach. So, all right, Mr. Sparrow, we're going to do this measurement fairly quickly so that you can sit on, we can get you back upright, okay?
Okay.
All right, so what I want you to do is to raise your leg as far as you can. Okay, and relax. So we're about a 5 on this side. All right, and now we're going to raise this one up and relax. Let's try that one more time. And relax. All right, actually really good on this side. You're a 7. Okay. All right, so we're cutting and now you're sitting.
I think it was better because I have resistance. So I was
Oh, yeah. All right, so this is where doing a muscle test. So you have to have your feet hanging off the edge, maybe from this side. Does that feel sturdy? Let's see if I have this anything. Okay. So I need to. Okay. All right, Mr. Sparrow, we have you up in this position. So we want to do some muscle testing for the muscles in the front of your leg, okay? And got you here right beside you to keep you steady, okay? But what I want you to do is to raise your foot up as far as you can. Okay, good job. And now let's try this foot over here. Okay, hold on. I wouldn't be setting your foot because you have a foot.
That's a blooper.
Okay, take 6. All right. Are you ready? Okay. All right, Mr. Sparrow, we have you in this position right now to test the strength of your muscles in the front of your legs, okay? So I'm right here beside you to keep you steady. So what I want you to do is raise this leg up as high as you can. Try to touch my hand. Okay, all right. And now what I want you to do is do the same thing with this side. Just raise it up. Okay, good job. All right, now rest easy. So that's about a 3 minus, and what we're aiming towards is a 3 plus. And that's going to, so that's what the exercise that we're going to do today is going to help strengthen those muscles. So that'll help you get around better in bed. Okay? Any questions? Okay. All right. So, yeah, with the mirror. Okay. Okay. Can't see my head.
I have been paying attention, don't worry.
I really do appreciate you
No problem.
doing that. Hopefully you can hear me. All right. So, all right, Mr. Sparrow, the first exercise that we're going to do are called quad sets. And basically what you're going to do here in a minute is squeeze the back of your knees into the table. So kind of like into my hand. You don't have to do it just yet. But we're going to do those while using a mirror. And the reason why we're using the mirror like so is that when you're doing the exercise and looking into the mirror, it's kind of re-educating your brain, which over time has been shown to kind of fool the brain into thinking that your leg is there, and that can help with pain, okay? All right, so go ahead and I want you to activate both muscles. So at the same time, you're going to push the back of your knee into the mat table. You're going to hold it for a goal of 5 seconds.
kind of hurts.
Yeah. It's going to hurt a little bit, so you just rest when you need to. And our goal is to do 5 sets, okay? So whenever you're ready, squeeze and hold it for as long as you can. Okay.
I'm supposed to be looking
Yep, and you're supposed to be looking at the mirror. Can you see the reflection of this leg in this mirror? Okay. So later on, when we talk about your home exercise plan, you're going to be doing some things with this foot and this ankle, like ankle pumps. You're going to use the mirror for that as well. Okay. All right.
Did 5.
Okay. Good job. All right. So now what we're going to do is, you did such a good job with those. We are going to add a little something to your leg. So we're going to prop off your leg with the pillow. And on this side, we're going to roll up this towel. Just a little bit, okay? Feel okay? Okay. So we're going to use the mirror again, and this time what I want you to do is raise the foot off of the table. So you're trying to raise this foot up. At the same time, you're going to raise up this limb.
Okay.
And it's the same thing. You're going to hold it for 5 seconds, as long as you can, and then rest. Good job. You're doing really well. Rest when you need to. And you can build up to this as well.
So if I can't hold it because of the pain,
You can let it down, rest, and then try again. Okay? All right, good job. All right, and then the last exercise that we're going to do, let's take these bolsters out. All right, the last exercise we're going to do is to strengthen the muscles that can help you with the bed mobility and eventually stand. So they're called glute sets, and basically all you're going to do is squeeze your butt, and you're going to hold that for 5 seconds, and you're going to do that 5 times, okay? So this shouldn't cause you any pain because we're not moving your leg, okay?
Okay.
So you're just going to squeeze your butt through here and hold it for 5 seconds, okay? And then release, okay?
how many times do I do this?
You're going to do that 5 times. So that's the goal for now. Do you have any pain with that?
No, it's about as the other ones.
Okay. All right. Okay, you're so smart. What I need to do is get you up here a little bit. Ooh, this down. All right, Mr. Sparrow, we have the bed rail up on this side for your safety, okay? What we're going to practice today is some bed mobility. Specifically, we're going to practice the rolling. We're going to do it a couple of times, okay? So the number one thing is to bend your knee. So can you bend your knee up for me? Good. And we're going to put your foot flat on the bed. Feel okay? Okay. And then this hand right here can come around to the bed rail. Yep. And what you're going to do is on the count of 3, I want you to push as hard as you can into that heel and pull with this hand to roll yourself over towards me. Does that make sense? Okay. So 1, 2, 3. Push, push, push. Good. And we're going back. All right. That's the motion that we're going for. And now what we're going to do is kind of do a little cheat so that you can do more of this on your own. So on the count of 3, I want you to do the same motion by pushing through your heel, pulling with your arm. 1, 2, 3. Okay, and we're rolling back. Okay. Feeling all right? Okay, you're doing really well. So now you're going to push down through your leg. On the count of 3. 1, 2, 3. Push, 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 push. Good job. And relax. Do you have any questions about that?
I don't think so.
Okay, well, you've done a really good job today. And what I'm going to leave you with is your home exercise plan. So these are things to do. These are things to do in between our sessions together. And the first, we already talked about these a little bit, but just to remind you, the ankle pumps for circulation. So you're going to, you can relax this leg in here. You're going to be doing the ankle pumps. Okay. You're also going to be doing the bracing. So that's where you take a deep breath and then you activate these muscles. Like somebody's going to punch you in the stomach, those muscles, and we talked about how to feel those muscles to make sure they're engaged. You're going to hold that for 5 seconds and then relax. And then the heel slides. So you're just going to move the heel up and down the bed. And you can use a towel for that. Okay? Do you have any questions?
I don't think so.
Okay. Well, you did a really good job, and I will see you tomorrow, okay?
Okay.
Okay.
I hope that I wasn't holding this too crooked because I would.
That's why I was going.